HESI nursing exam questions. Question 1. During a developmental screening, a 4-year-old child is asked to perform a task. Which of the following tasks should the nurse expect the child to perform? Draw a stick figure with 7 body parts. Draw a circle. Identify right from left hand. Tie their shoelaces. B. Draw a circle. Correct answer. At 4 years old, children are typically able to draw a circle, which is a developmental milestone for their age. Drawing a stick figure with specific body parts might be beyond their developmental level. Identifying right from left hand can be challenging, and tying shoelaces requires more advanced motor skills. Question 2. A nurse is teaching a group of parents about preventing childhood obesity. Which of the following instructions should the nurse include? Serve your child 1 to 2 cups of fruit juice daily. Feed your child whole milk until 2 years of age. Eat at least 1 fruit or vegetable with each meal. Limit your child's TV watching to 1 to 2 hours per day. D. Limit your child's TV watching to 1 to 2 hours per day. Correct answer. In pediatric nursing, preventing childhood obesity is a crucial aspect of promoting overall health and well-being in children. The correct answer, D. Limit your child's TV watching to 1 to 2 hours per day, is essential in preventing obesity because excessive screen time is linked to sedentary behavior and poor dietary habits. By limiting TV watching, children are encouraged to engage in physical activity and spend less time on passive behaviors that contribute to weight gain. Option A, serve your child 1 to 2 cups of fruit juice daily, is incorrect because excessive fruit juice consumption can lead to excess calorie intake and contribute to weight gain due to its high sugar content. It is recommended to offer whole fruits instead. Option B, feed your child whole milk until 2 years of age, is incorrect because after the age of 1, it is recommended to switch to low-fat or non-fat milk to prevent excessive saturated fat intake, which can increase the risk of obesity. Option C, eat at least 1 fruit or vegetable with each meal, is a healthy dietary recommendation, but may not directly address the prevention of childhood obesity as effectively as limiting screen time, which promotes overall physical activity and healthier lifestyle habits. Educationally, it is important for parents to understand the impact of lifestyle choices on their child's health. By explaining the rationale behind limiting TV watching to prevent childhood obesity, nurses empower parents to make informed decisions that promote a healthy lifestyle for their children. This guidance supports the holistic approach to pediatric care, focusing on both physical and mental well-being. Question 3. A healthcare professional is preparing to administer a vaccine to a child who has hemophilia. Which of the following actions should the healthcare professional take? Administer the vaccine subcutaneously. Administer the vaccine intramuscularly. Use a 1-inch needle. Apply pressure to the site for 1 to 2 minutes. B. Administer the vaccine intramuscularly. Correct answer. Administering the vaccine intramuscularly to a child with hemophilia is preferred to reduce the risk of bleeding. Hemophiliac individuals have a decreased ability to form blood clots, and administering vaccines intramuscularly reduces the risk of bleeding compared to subcutaneous administration. Using an appropriate needle length and applying pressure to the site post-injection are important steps, but choosing the intramuscular route is crucial in this case to minimize bleeding complications. Question 4. A healthcare provider is assessing an infant who has. Which of the following findings should the provider report to the healthcare provider? Decreased urine output. Temperature of 37.5 degrees Celsius, 99.5 degrees Fahrenheit. Heart rate 130 per minute. Leakage of cerebrospinal fluid. D. Leakage of cerebrospinal fluid. Correct answer. In this scenario, the correct answer is D. Leakage of cerebrospinal fluid. Following ventriculoperitoneal shunt placement in an infant with hydrocephalus, any leakage of cerebrospinal fluid is a critical finding that must be reported promptly. Cerebrospinal fluid leakage can lead to complications such as infection, meningitis, and shunt malfunction, which can be life-threatening for the infant. Option A, decreased urine output is not directly related to the infant's condition post-ventriculoperitoneal shunt placement and is not as concerning as cerebrospinal fluid leakage. Option B, a temperature of 37.5 degrees Celsius, 99.5 degrees Fahrenheit is within a normal range for an infant and is not a priority finding in this situation. Option C, a heart rate of 130 per minute is elevated, but can be a common response to surgery and anesthesia in infants, and may not be as urgent as identifying cerebrospinal fluid leakage. Educational context. Understanding the immediate postoperative care needs of infants with hydrocephalus who have undergone ventriculoperitoneal shunt placement is crucial for pediatric nurses. Recognizing and prioritizing critical findings, such as cerebrospinal fluid leakage, can help prevent complications and ensure the best outcomes for the infant. Regular assessments and prompt reporting of abnormal findings are essential in pediatric nursing care to provide safe and effective postoperative management. Question 5. A parent of an infant with congenital hypothyroidism is receiving teaching from a nurse. Which of the following statements should the nurse include in the teaching? Your child will need to take medication for a few months. You will need to give your child the medication every other day. Your child will need to take the medication until age 10. Your child will need to take the medication for life. D. Your child will need to take the medication for life. Correct answer. The correct answer is D. Congenital hypothyroidism requires lifelong medication to manage the condition effectively. The nurse should emphasize to the parent that their child will need to take the medication for life to ensure proper thyroid hormone levels and prevent complications associated with hypothyroidism. Question 6. A healthcare professional is reviewing the laboratory results of a child who has nephrotic syndrome. Which of the following findings should the professional expect? Hypoalbuminemia, hyperkalemia, polyuria, hyperglycemia. A. Hypoalbuminemia. Correct answer. In nephrotic syndrome, there is excessive loss of protein in the urine, leading to hypoalbuminemia. This results in decreased oncotic pressure, causing fluid to shift into the interstitial spaces, leading to edema. Hyperkalemia, polyuria, and hyperglycemia are not typically associated with nephrotic syndrome. Question 7. A patient is 1 hour postoperative following an open reduction internal fixation of the left tibia. Which of the following actions should the nurse take? Assess neurovascular status of the extremities every 4 hours. Monitor the patient's pain level every 8 hours. Assist the patient to the bathroom every 2 hours. Keep the patient's left leg elevated on 2 pillows. A. Assess neurovascular status of the extremities every 4 hours. Correct answer. It is crucial to assess the neurovascular status of the extremities every 4 hours to monitor for any signs of complications, such as impaired circulation or nerve damage. This frequent assessment helps in early detection of any issues that may arise postoperatively, allowing for timely intervention and prevention of potential complications. Question 8. A healthcare professional is assessing a child who has a rotavirus infection. Which of the following is an expected manifestation? Constipation, vomiting, jaundice, abdominal pain. B. Vomiting. Correct answer. In pediatric nursing, understanding the expected manifestations of common childhood illnesses like rotavirus infection is crucial for accurate assessment and intervention. In the case of rotavirus infection, vomiting is the expected manifestation. This is because rotavirus is a leading cause of severe diarrhea and vomiting in infants and young children. Option A, constipation, is incorrect because rotavirus infection typically presents with watery diarrhea, not constipation. Option C, jaundice, is also incorrect as jaundice is not a common symptom of rotavirus infection. Option D, abdominal pain, while possible in some cases, is not as characteristic of rotavirus infection as vomiting. Educationally, this question highlights the importance of recognizing key clinical manifestations of specific pediatric conditions. Understanding these manifestations aids in timely diagnosis, appropriate treatment, and effective patient care in pediatric nursing practice. By knowing the typical symptoms of rotavirus infection, healthcare professionals can provide targeted care and support to children affected by this common viral illness. Question 9. A nurse is providing teaching to the guardian of an infant about home safety. Which of the following statements by the guardian indicates an understanding of the teaching? I will place my baby on her stomach to sleep. I will put a small pillow in my baby's crib. I will keep my baby's crib away from the radiator. I will use a drop-side crib for my baby. C. I will keep my baby's crib away from the radiator. Correct answer. In pediatric nursing, educating parents and guardians on home safety is crucial to prevent accidents and promote the well-being of infants. Option C, I will keep my baby's crib away from the radiator, indicates an understanding of the teaching because it addresses the risk of burns or overheating for the infant. Placing the crib away from heat sources reduces the risk of accidental burns, ensuring a safe sleep environment for the baby. Options A, placing the baby on her stomach to sleep, and B, putting a small pillow in the crib, are incorrect as they both pose risks for sudden infant death syndrome, SIDS. Placing an infant on their stomach increases the risk of SIDS, while pillows and other soft bedding increase the risk of suffocation. Option D, using a drop-side crib, is also incorrect as drop-side cribs have been banned due to safety concerns. These cribs pose a risk of entrapment and suffocation for infants. Educationally, this question highlights the importance of educating caregivers on safe sleep practices and home safety measures to prevent common childhood injuries and accidents. It reinforces the need for evidence-based recommendations to ensure the well-being of infants. Question 10. A nurse is planning care for a 2-month-old infant who is postoperative following surgical repair of a cleft lip. Which of the following actions should the nurse take? Position the infant on his abdomen. Cleanse the incision site with hydrogen peroxide. Offer the infant a pacifier. Keep the infant's elbow restrained. D. Keep the infant's elbow restrained. Correct answer. In this scenario, option D, which is keeping the infant's elbow restrained, is the correct action for the nurse to take. The rationale behind this is that following surgical repair of a cleft lip, it is crucial to prevent the infant from touching or rubbing the surgical site to avoid disruption of the sutures and potential wound complications. Restraining the infant's elbow helps in limiting the infant's movement and reduces the risk of inadvertent injury to the surgical area. Options A, B, and C are incorrect actions for the nurse to take in this situation. Positioning the infant on his abdomen, option A, is not recommended post-cleft lip surgery as it can put pressure on the surgical site and may lead to discomfort or disruption of the wound. Cleansing the incision site with hydrogen peroxide, option B, is not advised as it can be harsh on the delicate skin of the infant and may impede the healing process. Offering the infant a pacifier, option C, is also not recommended immediately post-cleft lip surgery as sucking on a pacifier may put pressure on the surgical site and interfere with the healing process. In a pediatric nursing context, it is vital for nurses to have a comprehensive understanding of postoperative care following surgical procedures in infants. This includes knowledge of appropriate wound care, positioning, and strategies to prevent complications. By selecting the correct action of keeping the infant's elbow restrained, the nurse demonstrates sound clinical judgment and promotes optimal healing and recovery for the infant post-cleft lip surgery. Question 11. A school-age child is 4 hours postoperative following perforated appendicitis repair. Which of the following actions should the nurse take? Maintain the child on a clear liquid diet for 48 hours. Administer antibiotics for 7 days. Apply warm compresses to the surgical site every 4 hours. Keep the child on NPO status for 24 hours. B. Administer antibiotics for 7 days. Correct answer. Administering antibiotics for 7 days is essential postoperatively to prevent infections and complications in a child who underwent perforated appendicitis repair. This helps in reducing the risk of secondary infections and promoting healing. Clear liquid diets, warm compresses, and prolonged fasting are not the primary interventions indicated in this scenario. Question 12. When teaching a parent of a 2-month-old infant with acute gastroenteritis who is bottle feeding, which of the following statements should the nurse include? Offer Pedialyte between formula feedings. Feed the infant every 6 hours. Give diluted apple juice if the infant becomes dehydrated. Switch to soy-based formula permanently. A. Offer Pedialyte between formula feedings. Correct answer. In the case of acute gastroenteritis in a 2-month-old infant who is bottle feeding, the nurse should recommend offering Pedialyte between formula feedings. This helps prevent dehydration and ensures that the infant receives essential electrolytes and fluids to aid in recovery. Pedialyte is specifically formulated to help replace lost fluids and electrolytes due to vomiting and diarrhea, making it a suitable choice for infants with gastroenteritis. Question 13. A nurse is providing discharge teaching to the parent of a child who has juvenile idiopathic arthritis. Which of the following statements should the nurse include? Encourage the child to sleep for 8 hours each night. Perform range of motion exercises once per week. Give your child NSAIDs on a regular schedule. Apply heat to the child's affected joints twice daily. C. Give your child NSAIDs on a regular schedule. Correct answer. In pediatric nursing, providing effective discharge teaching is crucial for empowering parents to care for their child with juvenile idiopathic arthritis. The correct answer, option C, give your child NSAIDs on a regular schedule, is the most appropriate because NSAIDs, non-steroidal anti-inflammatory drugs, are commonly used to manage the pain and inflammation associated with arthritis in children. By administering NSAIDs on a regular schedule as prescribed by the healthcare provider, the parent can help control the child's symptoms and improve their quality of life. Options A, B, and D are incorrect for the following reasons. A. Encouraging the child to sleep for 8 hours each night is a general health recommendation, but does not specifically address the management of juvenile idiopathic arthritis. While adequate sleep is important for overall well-being, it is not the primary intervention for arthritis. B. Performing range of motion exercises once per week may not be sufficient for a child with juvenile idiopathic arthritis. Consistent and regular physical therapy, including appropriate exercises, is essential in maintaining joint mobility and function in these patients. D. Applying heat to the child's affected joints twice daily may provide temporary relief of symptoms, but is not a comprehensive treatment strategy for juvenile idiopathic arthritis. Heat therapy alone is unlikely to address the underlying inflammation and joint damage associated with the condition. In an educational context, it is essential for nurses to provide evidence-based and individualized teaching to parents of children with chronic conditions like juvenile idiopathic arthritis. By explaining the rationale behind specific interventions, nurses can empower parents to become active participants in their child's care and promote positive health outcomes. Question 14. A healthcare professional is preparing to insert an intravenous catheter for a 7-year-old child. Which of the following actions should the professional take? Apply an anesthetic cream to the insertion site 1 hour before the procedure. Use a 16-gauge needle for the insertion. Insert the catheter into a vein of the child's dominant hand. Choose a site over the child's metacarpal veins. A. Apply an anesthetic cream to the insertion site 1 hour before the procedure. Correct answer. Applying an anesthetic cream to the insertion site 1 hour before the procedure is crucial when inserting an intravenous catheter in a child to minimize pain and discomfort during the procedure. This practice is especially important in pediatric patients to ensure a more comfortable experience and improve cooperation during the insertion process. Question 15. When teaching a school-age child and the parent how to administer insulin, which of the following instructions should the nurse include? Store the insulin in the refrigerator after each use. Rotate injection sites each time you give the injection. You should give the insulin at room temperature. Administer the insulin within 30 minutes of each meal. C. You should give the insulin at room temperature. Correct answer. It is essential to give insulin at room temperature to prevent discomfort during administration. Cold insulin can cause stinging and pain, which can be avoided by allowing the insulin to reach room temperature before administration. Storing insulin in the refrigerator is correct for long-term storage, but it should be brought to room temperature before use. Rotating injection sites is important to prevent lipohypertrophy, a condition characterized by fatty lumps that can develop if injections are consistently given in the same area. Administering insulin within 30 minutes of a meal is generally recommended to match the insulin peak action with the peak glucose levels after eating, but giving insulin at room temperature is more crucial to ensure comfort and proper absorption. Question 16. A parent of a child with celiac disease is receiving teaching from a nurse. Which of the following statements should the nurse make? You should give your child vitamin supplements that contain iron. Your child will need a gluten-free diet. Your child should consume large amounts of dietary fiber. Your child can resume eating whole wheat bread. B. Your child will need a gluten-free diet. Correct answer. The correct answer is B. Celiac disease requires a strict gluten-free diet to manage the condition effectively. Gluten-containing foods like wheat, barley, and rye must be avoided to prevent intestinal damage and symptoms in individuals with celiac disease. Therefore, the nurse should emphasize the importance of a gluten-free diet to the parent of the child with celiac disease. Question 17. A child is being cared for by a nurse and has rheumatic fever. Which of the following actions should the nurse plan to take? Administer aspirin to the child as prescribed, based on the healthcare provider's instructions. Encourage adequate fluid intake for the child. Elevate the child's joints and provide warm compresses. Monitor the child's heart rate for dysrhythmias. D. Monitor the child's heart rate for dysrhythmias. Correct answer. Rheumatic fever can lead to cardiac complications, such as dysrhythmias. Therefore, it is essential for the nurse to monitor the child's heart rate closely for any signs of dysrhythmias. This will help in early identification and prompt management of potential cardiac issues associated with rheumatic fever. Question 18. A caregiver is learning about administering digoxin to a toddler. Which statement by the caregiver indicates an understanding of the teaching? I will mix the medication with a small amount of juice. I will give the medication with meals. I will give a second dose if my child vomits. I will give my child water after giving the medication. D. I will give my child water after giving the medication. Correct answer. The correct statement is D because giving the child water after administering digoxin helps ensure the medication is swallowed properly. Mixing the medication with juice, choice A, may affect its absorption. Giving the medication with meals, choice B, may interfere with its effectiveness. Administering a second dose if the child vomits, choice C, is not recommended as it may lead to an overdose. Question 19. A parent of a child with cystic fibrosis is being taught about dietary guidelines. Which statement by the parent indicates an understanding of the teaching? My child should eat a high-calorie, high-protein diet. My child should avoid eating eggs. My child should follow a low-fat, low-sodium diet. My child should follow a high-fiber, high-protein diet. A. My child should eat a high-calorie, high-protein diet. Correct answer. In the context of pediatric nursing, particularly in the care of a child with cystic fibrosis, the correct answer is A. My child should eat a high-calorie, high-protein diet. This response reflects an understanding of the dietary needs of a child with cystic fibrosis. A high-calorie, High-protein diet is crucial for children with cystic fibrosis as they have increased energy needs due to malabsorption issues. Protein is essential for growth and development, while a high-calorie diet helps meet the increased energy requirements of these children. Option B, my child should avoid eating eggs, is incorrect as eggs are a good source of protein and essential nutrients. Unless the child has a specific allergy to eggs, they can be a healthy part of the diet. Option C, my child should follow a low-fat, low-sodium diet, is incorrect because children with cystic fibrosis actually require higher fat intake to aid in the absorption of fat-soluble vitamins. Sodium restriction is not a primary concern unless the child has a specific medical condition that requires it. Option D, my child should follow a high-fiber, high-protein diet, is incorrect as high-fiber diets may further impede nutrient absorption in children with cystic fibrosis who already have absorption issues. In an educational context, it is important for pediatric nurses to understand the specific dietary needs of children with cystic fibrosis to optimize their growth, development, and overall health. Providing accurate and clear dietary guidelines to parents is essential in managing the condition effectively. Question 20. A school-age child is 2 hours postoperative following a tonsillectomy. Which of the following actions should the nurse include in the plan of care? Place a heating pad at the surgical site. Encourage the child to cough every 2 hours. Administer analgesics to the child on a regular schedule. Apply an ice collar to the child's neck. D. Apply an ice collar to the child's neck. Correct answer. After a tonsillectomy, applying an ice collar to the child's neck helps decrease pain and swelling. Heat should be avoided as it can increase bleeding. Encouraging coughing may increase the risk of bleeding. Administering analgesics on a regular schedule is essential for pain management, but the immediate postoperative period may require additional interventions like ice collar application. Question 21. A healthcare provider at an urgent care clinic is assessing. Which of the following findings should the provider recognize as a manifestation of pertussis? Inflamed throat with exudate, purulent eye drainage, dry, hacking cough, Koplik spots on buccal mucosa. C. Dry, hacking cough. Correct answer. The correct answer is C. Dry, hacking cough. A dry, hacking cough is a classic manifestation of pertussis. Pertussis typically presents with symptoms of an upper respiratory tract infection, starting with a persistent, severe, and uncontrollable cough that can worsen at night. This cough is often followed by a high-pitched whoop sound as the patient tries to catch their breath, hence the term whooping cough. In contrast, options A, B, and D are not typically associated with pertussis. Inflamed throat with exudate may suggest a bacterial throat infection like streptococcal pharyngitis. Purulent eye drainage is more indicative of a bacterial conjunctivitis, and Koplik spots on the buccal mucosa are specific to measles. Therefore, recognizing the dry, hacking cough as a manifestation of pertussis is crucial for early identification and appropriate management of the disease. Question 22. A caregiver is providing teaching about car seat use to them. Which of the following statements by the mother indicates an understanding of the teaching? I should secure the car seat using lower anchors and tethers instead of the seat belt. I should position the car seat harness 1 inch above my baby's shoulders. I will make sure that the car seat is placed at a 90-degree angle. I will pad my baby's car seat with a blanket for traveling long distances. A. I should secure the car seat using lower anchors and tethers instead of the seat belt. Correct answer. The correct answer is A. Lower anchors and tethers, known as the latch child safety seat system, should be used to secure an infant's car seat in the vehicle. This system provides a safer and more secure way of installing the car seat compared to using the seat belt alone. Using the lower anchors and tethers ensures proper installation and reduces the risk of car seat movement during travel, providing optimal protection for the infant. Question 23. A healthcare provider is assessing the pain level of a 3-year-old toddler. Which of the following pain assessment scales should the healthcare provider use? Faces Pain Rating Scale. Numeric Pain Rating Scale. Cries Pain Assessment Scale. Non-communicating Children's Pain Checklist. A. Faces Pain Rating Scale. Correct answer. The healthcare provider should use the Faces Pain Rating Scale for pediatric clients who are 3 years old and older. This scale allows the toddler to point to the face that depicts the current level of pain, making it a suitable choice for nonverbal or young children who may have difficulty expressing their pain verbally. Question 24. A preschooler is scheduled for hydrotherapy treatment for wound debridement following a burn injury. Which of the following actions should be taken prior to the procedure? Apply topical antimicrobial ointment to the child's wound. Place a mesh gauze dressing over the child's wound. Administer an analgesic to the child. Initiate prophylactic antibiotic therapy for the child. C. Administer an analgesic to the child. Correct answer. The correct answer is C. Administer an analgesic to the child. Prior to hydrotherapy treatment for wound debridement in a preschooler following a burn injury, it is crucial to provide pain relief to ensure the child's comfort and cooperation during the procedure. Pain management is essential in pediatric care to reduce anxiety, promote healing, and improve overall outcomes. Option A, apply topical antimicrobial ointment to the child's wound is incorrect, as this step should have been taken earlier in the wound care process and is not specifically needed prior to hydrotherapy treatment. Question 25. A child is being cared for following a head injury. Which of the following findings should indicate to the healthcare provider that the child is developing diabetes insipidus? Urine specific gravity of 1.045. Sodium level of 155. Blood glucose level of 45. Urine output of 35 milliliters per hour. B. Sodium level of 155. Correct answer. In a child with a head injury, the development of diabetes insipidus can occur due to pituitary hypofunction, leading to a deficiency of antidiuretic hormone. An elevated sodium level, hypernatremia, is a key finding in diabetes insipidus due to the excessive loss of free water in the urine, resulting in increased sodium concentration in the blood.